All right, well, welcome all, both those joining synchronously and those who are enjoying our session asynchronously. We're really grateful to have you engaged with us. My name is Hannah Rochford. I'm one of the co-chairs for Safe States Alliance Student and Early Career Professionals Special Interest Group, and I am very grateful to have Emily Kumpf with Hopkins as my co-chair. So today we're convened for a very exciting purpose. We're showcasing some of our community's best and brightest students and early career professionals. So the purpose of today's discussion is to give you all a sense of their pathways, their interests, and how they found themselves in the injury and violence space. We have some folks who have research interests, others have practice interests, and we know that both of those are really central to Safe State's purpose. So we hope that today our attendees will come away with some tangible things that they can apply to their own professional journeys. So again, thank you for making time for today's session. Before we dig into that content, we want to be sure that folks are aware of exactly what the Safe State Student Early Career Professionals SIG or Special Interest Group can mean. This is intended to be a very welcoming, approachable community for folks who are either actively in training or have completed training within the last 5 years. So Safe States Alliance is a hugely important part of developing our nation's injury and violence prevention workforce. And so we hope that this professional community can be a great place to start building your network and finding peers who can support you in your professional journey and foster growth and shared interests. So as we noted, Emily and myself are co-chairs. And we've stated this briefly, but just to reiterate, our SECP, or Student Early Career Professional Student Interest Group, is meant to be a forum where members who are in the earlier stages of their professional trajectory can network with each other, develop as professionals, and amplify the student and early career professional voice within efforts that occur in Safe States Alliance. So the way that we define students and early career professionals are students who are actively enrolled in undergraduate or graduate programs, or those who completed or exited their training within the last 5 years. So the mission of our group, we've briefly noted, but to state in a more official capacity, this community is meant to provide students and early career folks with a community that they can connect through with peers, that they can identify mentors, that they can engage with professional development opportunities and resources like the one that we are hosting today. And again, make sure that Safe States Alliance leaders have a really clear sense of the student and early career professional voice in terms of their needs and their preferences within the organization. If you haven't considered previously, we would love to invite you all to consider joining our SECP SIG as members. As a member, some of the benefits that you would be able to enjoy would be, again, opportunities to network with peers and established professionals. These networking opportunities happen virtually throughout the year, as well as synchronously at our annual conference. The opportunity to explore potential career pathways. Often this occurs via these e-sessions like the ones we're hosting today. But again, the annual conference is another great opportunity to engage with folks and learn about all of the really rich ways to contribute professionally to injury and violence prevention. Contribute to and benefit from project-based initiatives. So Safe States Alliance looks to the Student Early Career Professional SIG as a hub for developing different projects, different initiatives that are important in serving our newer professional members. Further, developing injury and violence prevention content expertise Safe States Alliance has a ton of resources, and you can think of the Student and Early Career Special Interest Group as kind of a starting place to help navigate to the resources that may be most beneficial to you, and relatedly expanding technical skills with different skill building workshops, all available through Safe States Alliance Training Hub. Without further ado, hopefully that was a helpful overview of the Student Early Career Professional Special Interest Group. But we are very pleased to have 4 students and early career professionals from our community with us. So we'll get to hear a little bit about each of them as individuals, what their professional journey into injury and violence prevention has looked like, and what their current professional roles entail. So hopefully this can be a helpful learning opportunity for, again, those present with us today and those consuming this content in the future. So without further ado, Jess, I will stop my screen share and transition onto you.
Thank you so much. Let me get this set up. All right, give me just one more second. Okay, can everybody see my screen?
Yes.
Gonna thank you, because I can't see any of you. So as Hannah said, my name is Jessica Ritter. I currently serve as the State Office Coordinator of Safe Kids Pennsylvania, and I use she, her, or they, them pronouns. Safe Kids Pennsylvania is currently run by the American Trauma Society PA Division. And for those of you who don't know, we focus primarily on preventing unintentional childhood injuries. And that ranges from, different topic areas like car seat safety to drowning prevention to fire safety and other broad topics. It's a lot of fun. It always keeps us on our toes. So for me, my path, as I have titled, has been a little bit winding. I started in school, I mostly studied religion. I also have a degree in sociology with a minor in Holocaust studies. And when I was in grad school getting my MA in religious studies, I also minored in women, gender, and sexuality studies. I started my career path not in public health. I had a political fellowship for a little bit, which was absolutely crazy. And then I actually entered into library administration, doing a lot of behind the scenes work and making sure that all of the I's were dotted and T's were crossed. I entered into public health doing domestic violence and sexual assault work. I, at the time, did not consider it public health work. It was never actually described to me that way. And so it wasn't actually until I got into Safe Kids Pennsylvania and became a member of the Safe States Alliance that I understood that that work was also easily within the realm of public health. So I call that my entry into public health, even though I did not think about it at the time. Here at Safe Kids PA, there are a ton of things that I'm really excited about, and I could not actually just choose one. So we're doing a ton of work. I actually just hired a state office associate to help work with me, and that's been going really awesome. So hopefully that will continue to expand our work. But right now we're prioritizing doing translations of different materials into needed languages within Pennsylvania. And so most recently, we translated Safe Kid Worldwide has a family safety activity book, and we were able to translate that into 3 different languages. It was already available in English and Spanish. We got it translated into Arabic, Haitian Creole, and Nepali for our community. And we have plans to continue translating other materials into requested languages from our local groups that we work with who do the on-the-ground work. Another exciting thing that I'm a part of is the Anti-Racism and Health Equity Work Group through the Safe States Alliance. I have been a part of this work group for about 3 or 4 years now, and it is just a really wonderful space where we get to have really nuanced and interesting conversations about how our work can be viewed through the lens of anti-racism and health equity, and how we can really grow those efforts towards health equity within our fields. Other things that I'm excited about include mini grants. Every year, the State Office of Safe Kids PA gets to basically operate as pass-through funding to our local groups. We have 20 local groups throughout PA, and they can apply for funding of up to $6,000 from the state office to do a safety initiative within their community. To do this, in order to receive funding, they need to show that there is a need for their project within their community, relying on data and evidence. And then they also need to take health equity considerations into account of how they would best serve marginalized groups, or just take different considerations into their plans. And it is just always really awesome because you get to see all of this really cool work that people are doing. But then you also get to give people money to be able to do the good work. And it's just always really exciting. So right now, we're in the implementation phase, and then in about 6 months, I will get all of the final reports to be able to see how everyone's project went. And I'm always super pumped for that. And then finally, we've started a new initiative called the Summits, where we are regionally going around Pennsylvania and bringing people together from the Safe Kids PA groups and the child death review teams that operate in our state. And we're bringing them together into one space to talk about each other's work and talk about how we can best work together to bring data into practice, and better inform our prevention efforts. We're supposed to be talking about research and practice partnerships, and unfortunately at this point, I don't actually have any solidified research practice partnerships, but I am always open for that. So if you know anybody and want to hook me up, I'm fine with it. I do try to incorporate research into my work and make sure that I, our associate now, and also all of the local groups stay up to date with recent research that's come out that's relevant to the injury areas that we cover and can help make the work that we do more effective in terms of implementation, and more beneficial in terms of outcome. And then finally, for me, what has been helpful throughout my career is it's a lot of different stuff, but really being open to learning from anyone, regardless of their status or their job title, or even what field they are in. Often I have found that there are a lot of transferable ideas that can go from field to field and can be absolutely useful in public health. Kind of following on that is these unofficial conversations, not necessarily within a formal mentorship relation, but again, just being open to learning from anybody and having those conversations where you get to ask like, oh, how did you solve this problem? And how did you kind of work through this? And being able to translate that to my own work has been wildly helpful. Saying yes to various opportunities, as long as you have the capacity to do so, that has also been something that's been really helpful to me, even if it's something that I haven't always been comfortable with. Through the Safe States Alliance a few years ago, I was able to do a policy fellowship, which is something that I had never done before, but someone encouraged me to apply. And so I did, and it was a huge learning experience, and it was really awesome. And you can be accepted into these various opportunities via unofficial conversations. At least that's what happened for me. And then finally, really just being curious, asking why things work the way that they do, and how that's been beneficial and who it's been beneficial for. Just being open and curious has really led my career down a very different path than I would thought that I would be, like even a decade ago. So that is it for me. And now I am passing it on.
Thank you so much, Jess. I think those are certainly helpful points to start with. I want to pause, given one of the things that you mentioned in terms of kind of seeking research and practice partnerships. So I know, based on our roster of not only other speakers, but also attendees, that we have some really fantastic researchers here. And so please feel encouraged to drop your contact information in the chat if Jess's work resonated with you and you see an opportunity to build some partnerships with Jess in that research to practice space.
Absolutely, I would welcome that. Thank you, Hannah.
Excellent. Okay, so next, I'm going to pass things over to Fran. Fran, go ahead and share your screen whenever you're ready.
Okie dokie. Can you see my screen?
Looks great.
And is it the right screen, not with the notes or anything?
Yeah.
Okay, awesome. So, hi everyone. My name is Francesca Marate. I go by Fran. My pronouns are she, her. And I am an epidemiologist in training at the Massachusetts Department of Public Health. So for my educational background, I received a Bachelor of Arts in Mathematical Sciences with a concentration in pre-medicine from Binghamton University in 2021. I always had a plan since I think early college to late high school to join the public health field as an epidemiologist, but I had only really known of the path of doing kind of an MD, MPH joint degree. So that was kind of my plan here with my undergraduate degree and why I decided to do pre-medicine. And I knew that you can basically do a concentration in pre-medicine with any kind of degree. So I thought, I'm really good at math. I love science. So mathematical sciences was my major. And that was why I have this particular degree that no one really finds very common. So from there, at some point in the end of my undergraduate years, I realized that maybe medical school may not be for me, at least at the moment. So I wanted to really get my master's, especially if I was considering a PhD in epidemiology in my future. I think a lot of programs require that you need to at least have your MPH. So I thought the natural next step, and then see how I feel from there, would be my MPH. So from the same university as my undergrad, I got a generalist MPH degree, as well as a nursing certificate in disaster management in 2023. And then since 2023, I've been in a fellowship program with the Council of State and Territorial Epidemiologists, or CSTE. So for a bit of background on that, the CSTE is a nonprofit, organization that acts as the professional home for applied epidemiologists across all U.S. states and territories. And their Applied Epidemiology Fellowship, or AEF program, is a 2-year mentorship program for recent graduates where we gain on-the-job training and experience at a state, local, or tribal health department under the guidance of 2 experienced mentors. One thing about the mentorship program is that it's kind of a 2-way street in terms of who joins the program. So host site epidemiologists must also apply and be matched to one another to be applied and be matched with recent graduates to be part of the program, both as mentors and mentees respectively. So if anyone is ever interested as a host site epidemiologist or mentor, or as a recent graduate or mentee to apply for the program, you are able to do so. So one description for my role would be that my projects and tasks as a fellow are based on fulfilling the fellowship competencies and the needs of the injury surveillance program at the Massachusetts Department of Public Health. So it's very mutually beneficial. And it's also mutually beneficial for me as I gain my experience. Most of my tasks and projects are related to motor vehicle crash injuries, and some of them include analyzing large data sets, creating a surveillance system, conducting a qualitative study, and so on. So one of my favorite projects is a qualitative study I'm conducting that aims to identify the root causes of inequitable motor vehicle crash injuries and outcomes among Black and Hispanic drivers and passengers in Massachusetts. For all my projects, I've done literature reviews, which I find very essential to kind of build the groundwork of what my research question will be for all of my projects. And so given information, we found that on a national level, as well as on a state level, Black and Hispanic passengers and drivers, or as we call occupants altogether, had kind of inequitable rates of motor vehicle crash injuries. And not only that, but more severe outcomes, especially among age groups of young adult ages to mid years, such as 18 to 44. So that's where we built our research question for this project. Throughout this project, some of my tasks kind of ranged a lot of applying and gaining IRB approval. I also helped interview and hire an intern for this project who was our note taker and helped me facilitate focus groups and is currently assisting us with data cleaning and analysis. So I have some experience in hiring now, and I find that it wasn't planned or expected necessarily, but is very helpful to me in my career. And has also changed my perspective from being someone who's been interviewed or an interviewee to being an interviewer. And now that affects my frame of thinking in a much more improved way of how I go about interviews when I look for jobs. In this project, I've also researched, contacted, and maintained a relationship with each of our community partners, and I helped create the data collection and recruitment materials. And so overall, I've facilitated 9 in-person focus groups and 2 virtual groups, which wouldn't have been as successful without our partnerships with community-based organizations, as they were in charge of recruiting participants. This project was very transformative for me, as I was responsible for most of the project tasks. My fellowship mentors did a great job showing me the administrative side of project management that I hadn't gotten to practice before. And I believe this was the most responsibility I've ever been given on a project, and there were definitely some hard lessons learned that I can't wait to take with me throughout the rest of my career. Another favorite project of mine that I really wanted to mention was where I created a surveillance system that aims to capture work-related motor vehicle crash injuries and deaths within the state. I used several data sources from the Massachusetts Crash-Related Injury Surveillance System, which we call MASCRIS, to create this system in collaboration with our occupational health surveillance program. So a special characteristic of the system is that it also identifies gig workers, which has piqued the interest of several other state health departments, federal agency, NIOSH, and nonprofit organization ATSIP. I'm currently drafting a white paper on the project's methodology and results that I hope to share in the next few months. So this project, as you can tell, is more on the coding, data linkage, and analysis side of being an epidemiologist compared to the other project, which had to do a lot of project management, some administrative tasks here and there, collaboration with partners and things of that nature. This took a lot of data cleaning, deterministic linkage, deduplicating, resolving one-to-many matches, and descriptive statistics. To find gig workers, we also had to do a whole lot of text mining in the narratives of available data sources, and therefore a lot of trial and error, but it was definitely worth it. My fellowship mentors also did a great job helping me with all this work by validating my code, helping me when I was stuck, and figuring out what our next steps would be. So when it comes to my mentorship, I think as Jessica mentioned, there is definitely a lot of unofficial mentorship going on, as well as some official mentorship in my experience. So chronologically, starting with my my graduate program, the program director, Dr. Yvonne Johnston, and one of our associate professors, Dr. Maisha Marzell, helped me decide my next steps post-graduation. So given that I earned a generalist degree in public health, I really wanted to find experience or training that specializes in epi and biostats. And I struggled to find the difference between a PhD and a DRPH in epidemiology. And I also wasn't sure if I wanted to dedicate another 5 or so years to academia. So speaking with both Dr. Johnson and Dr. Marcella about my concerns and thoughts, this helped me realize that if I'm not ready to dedicate myself to earning another degree, then I shouldn't feel pressured to do so at the moment. I always have time. So that helps me kind of jump off the train of immediately going into a doctorate program after my graduate program. Additionally, within my last year as an MPH candidate, I also joined the CSTE Early Career Mentorship Program, which is completely virtual and very flexible to meet your schedule. There, my mentor, Siobhan Dodds, is an epidemiologist at the Tennessee Department of Health's Integrated Food Safety Center of Excellence program. My mentorship with her was the catalyst for what brought me to the AEF program. She essentially helped me with the transition from student to fellow and taught me how to find epidemiology jobs and how to advocate for myself as a job candidate. Lastly, my current mentors in the AEF program, Dr. Sam Riley and Dr. Jeannie Hathaway, have helped me tremendously in improving and learning new skills as an early career epidemiologist. This list here showcases all the ways they've helped me build my confidence as an epidemiologist and feel prepared to take on new and exciting tasks. They've also helped me look and build connections and networks when I asked them to regarding my next steps of where would I want to go next after this fellowship program. And additionally, their dedication to injury and violence prevention has inspired me to try to remain in the field post-fellowship. So I definitely truly appreciate all their hard work, kindness, and dedication to being my mentors because it has gone a long way. Here you can find the State Health Department and my connections if you're interested in asking me more questions or looking into the State Health Department itself. And thank you so much for listening, and I'll pass it to the next presenter.
Awesome. Thank you for your words, Fran. Those sound like awesome projects. And I love several of the things you mentioned, but I think some of the takeaways that resonated particularly with me was the idea of it's not just the decisions that happen at the federal level, right? Our local level public health work is hugely important in understanding the challenges, right, that our researchers and our practitioners should be prioritizing. The importance of community partnerships in rigorous research as well as in practice that's actually going to advance safety and equity in a meaningful way. I loved. And the opportunity to make contributions to injury and violence regardless of the level of training one has, of the credentials that one already has behind you. I think all of that was extremely insightful and well said. So excited to hear next from our third speaker, Mia. So whenever you're ready, Mia, go ahead and pull up your slides.
Thanks, Hannah. Can everyone see my slides all right?
They look great.
Okay, amazing. So hi, everyone. My name is Mia Assar. I'm a research associate affiliated with the Department of Health Policy and Management at Johns Hopkins University at the Bloomberg School for Public Health. And I am primarily with the Center for Injury Research and Policy, and really excited to speak to you all today about what my trajectory has been like. Ooh, 1 second. There we go. So just a little bit of background kind of on how I got to where I am. I have also followed a little bit of a non-traditional path to a public health career. So I started off as an undergraduate, not as a public health major. But one issue that I was really passionate about and interested in was gun violence prevention. And by way of an internship at the Educational Fund to Stop Gun Violence, which is a nonprofit gun violence prevention think tank rooted in a public health framework, I kind of started to realize the power of a public health approach in addressing a lot of issues that I think otherwise can feel really intractable, difficult to make a difference on. And that sort of those tools of public health, evidence-based, data-driven approaches, community collaboration, understanding the root causes, rooting everything in an equity lens, that felt really empowering to me. And in my subsequent position as a communications researcher at the Frameworks Institute, which is a nonprofit communications and message framing think tank, I built my research skills while continuing to be really fascinated by that public health approach to various issues, which spurred me to get my MPH at Johns Hopkins at the Bloomberg School of Public Health. And through a practicum experience that I had during that program at the Anne Arundel County Gun Violence Intervention Team, where I worked on gun violence prevention, policy and programming, community events, dissemination of best practices, things like that. I realized that that was the niche that I felt like I was making a difference on an issue that I really cared about, and was fortunate enough to be able to stay on at Johns Hopkins as a research associate, working primarily in gun violence prevention, but also with a portfolio that includes some injury prevention research, unintentional injury prevention research. So a project that I'm working on that I wanted to highlight is a program that seeks to link clinicians to the Extreme Risk Protection Order, or ERPO, petitioning process via designated navigators that operate in clinical settings. So just in brief, essentially the problem that we wanted to address, and for those of you who don't know, Extreme Risk Protection Orders are a civil order that are aimed at creating space and time between people who might be experiencing a mental health or behavioral health crisis and lethal means. So they're not criminal. They're just intended to address firearm-related risk among people who are experiencing that level of crisis and might be at risk to themselves or others. And we were hearing from clinicians who are eligible to pursue this type of order under Maryland law, where Johns Hopkins is and where I'm based, that this was a tool that they thought could be really beneficial to patients, that they wanted to use, that was applicable to their duty of care to patients, but that due to lack of knowledge about the law, lack of time in their schedules, lack of ability to engage in the logistical processes around appearing in court, things like that, that they weren't able to use this tool that they thought could be really important in the spectrum of patient care that they wanted to provide. So with that in mind, the Injury Center, Johns Hopkins Hospital, and a nonprofit partner, Baltimore Crisis Response, Inc., that I'll talk more about in a second, have been piloting an approach that creates a clinical navigator, so a clinician who can petition for this order under Maryland law and who understands both the ERPO process and patient care sufficiently to accept referrals from clinicians, evaluate patients, and then pursue ERPOs where it's necessary and appropriate, but also to consider other interventions that might work for that particular patient. And where my role has come in is I am really coordinating the evaluation of this program, which is a formative evaluation at this stage. So designing instruments to understand how clinicians and program staff are experiencing the program, whether it offers an advantage over current approaches. So that's been mixed methods. We have a survey out to clinicians. I've been conducting some interviews. Soon we're going to be speaking directly to people who are under an extreme risk protection order as a result of engagement with these clinical navigators, which is really exciting. And so my role really has been on that data side, but also being immersed in the qualitative aspects, as Fran said, has allowed me to understand it in depth and really get the lived experience of people who we are trying to benefit with the program. And there's me actually very recently, like 3 days ago, presenting some of this research at the National Research Conference for the Prevention of Firearm-Related Harms. I think I got that one right. I'm not sure if anyone was there, but yeah, would love to connect and hear how your experiences of the conference were, like share more about the project if you're interested. And then related to that particular project that I'm working on, I wanted to talk a little bit about the practice collaboration elements of it. So as I mentioned, the way that this program has worked is the person who is navigating the process for clinicians at Johns Hopkins Hospital is a social worker that works at Baltimore Crisis Response, Inc. And this model was developed as a collaboration between the Injury Center at Johns Hopkins Hospital, and that nonprofit based on the expertise of each of us in our respective areas and a shared mission to get this practice out to clinicians who want to use it. And I just wanted to highlight a few things that I think have made that collaboration particularly successful. So first of all, this particular project was built on a longstanding, existing, more informal relationship between people at Johns Hopkins Hospital, at the Injury Center, and at Baltimore Crisis Response. They had been to a lot of the same events together. They had collaborated on initiatives that involved going into the hospital with community-led interventions and making sure that patients who were seeing clinicians in the hospital could subsequently connect to resources afterwards. So that relationship, I think, really helped form the foundation of a new project that we were working on together. Another thing, kind of relatedly, is that this is a mission that both parts of the partnership, the research side and the practice side, felt really passionate about. Baltimore Crisis Response, BCRI, are a 988 operating center, so they accept those calls and have been really invested, obviously, in suicide prevention, behavior and mental health crisis work because of that, but also specifically in extreme risk protection orders as a potential approach that can be offered to patients. So it built on something that they really wanted to do and that we felt passionate about as well. And then the final one, which I think is the most important, is a sustained commitment to learning from one another. So while Johns Hopkins, we, on our research side, know a lot about the methods that it takes to evaluate an intervention, the community partners, BCRI, really are the experts in what patients need when they're in a behavioral and mental health crisis, how to triage those needs on a short-term basis, and what the most appropriate response is to offer them, and sort of how to manage that from a program perspective. So I think being committed to learning from each other and not assuming that either is the expert on something, but more thinking about what can we offer one another as we're trying to support a common goal has been important. And then I just wanted to highlight a few things that have been helpful to me personally in my professional development. So I'm kind of thinking of these from the perspective of like when you're approaching someone who you think might be helpful to you. One of them is just knowing your goals, and that can change a little bit depending on who you're talking to. So just thinking about questions like, what do I want to learn? What types of changes do I want to make in the world or in the public health field? And maybe that's research translation, maybe that's like a methodological approach you want to learn, but whatever that might be, kind of tailoring it to who you're talking to, but also remaining confident in who you are and like what you want to do. Attending events like industry events, career events, conferences, things like that, and putting your work out there. And then finally, maintaining connections with people you've met along the way. So when there are opportunities that your organization might be offering, or just other avenues of potential collaboration that you see in your day-to-day work, or new opportunities that you're interested in that could have an avenue for someone that you've met in the past or that you want to continue working with, being mindful of that and kind of not being afraid to reach out, because a lot of the times, especially in this field, people have a lot of the same missions, and you would be surprised who wants to collaborate on different projects and how you can build really long-term relationships that way. So I'll end there, but yeah, really grateful for the opportunity to speak with you all and would love to hear more and connect in the Q&A or after the session.
Awesome. Thank you so much, Mia, for your helpful words. I see Samantha in the chat is certainly already interested in connecting. So I'll let you review that message if you haven't already. But I love how your discussion built on some of the things that Fran also mentioned, how community partnerships can be so central to increasing the equity and the advocacy of our research and our practice-based efforts. Fran's work highlighted the opportunity for impact with some of our unintentional, right, our motor vehicle outcomes, whereas your work with ERPOs is highlighting the potential for impact with our intentional injury outcomes, with so ERPOs being particularly oriented towards prevention of violence towards self and others. I also loved what you said about knowing your goals. I feel like we all perhaps conceptually know as early career folks that mentorship is really immensely important, but knowing where to start those conversations with potential mentors can be really daunting. So I think having a really clear sense of what one is hoping to achieve can maybe lay a foundation for right mentors to even know how to be helpful. So all awesome things to think about. And so last but certainly not least, I'll shift to Emily for some closing thoughts.
Thank you so much, Hannah. And it was
Oh, Emily, my friend, I apologize. Your sound is just a touch low. I don't know if you can adjust those settings before getting too far in.
okay. Is this better?
Oh, kind of the same.
Okay. Perhaps
Still
I
the
can
same.
speak up if that's
Yes.
my apologies. It was working a few minutes ago, but that's okay. The show will go on. Okie doke. Okay, now working. Excellent. Thank you. And my apologies. Feel welcome to flag me if it starts getting weird again. I am a chatty person, and apparently my computer is over that. So let me pull up slides and put it in the right version so that you are not staring at something that you don't need to look at. Okay.
Perfect. Looks great.
Awesome. Well, thank you so much, Hannah, and thank you for your patience, everybody, as I got things sorted over here. It was really cool to hear about Jessica, Francesca, and Mia's experiences. So hopefully this is just a little addition to that. But I think they did an awesome job. So hi, everyone. My name is Emily Nicholls. I use she, her pronouns, and I work at the Oklahoma State Department of Health in the Injury Prevention Service. And I have been there, I've just now 4 years. So cool. My role and path, I think it's kind of neat to hear some other people that have had different kind of windy versions, because if you had asked me, in school or at any point, I would not have kind of been like, oh yeah, I'm going to work at the state health department. But right now, I serve as the violence prevention coordinator. And so my two main programs are our rape prevention and education program and our partner inflicted brain injury program. And so slight content warning for gender-based violence. We're not going into all of the things, but it will be mentioned. And I've been fortunate enough to get involved with different kind of boards, committees, and things like that in my role within like my SDH role. And then I'll mention safe states things in a little bit. And before that, I worked at a local domestic violence and sexual assault victim service agency. So I started there as a volunteer advocate because I was passionate about the subject matter and being able to help other folks who'd had similar experiences to mine. And I kind of never thought like, oh, this is something I should do professionally, because don't people go to school for that? And 6 months later, I was working there full time. And so you can do that too, if you're interested. And so working as an advocate, supporting people who had experienced sexual assault, primarily doing things like accompanying them in forensic medical exams, court proceedings, protective order filings, and just generally helping them navigate what their options are. And while I was doing that, which I really love doing, I also kind of started thinking about prevention, which has been on my mind for a long time, and realizing that there are a lot of policy things in addition to that individual level education that people would really benefit from. Like there are things that, schools should do to protect students and help support people. And so that's kind of what encouraged me to get interested in switching to that route. And kind of what about a public health background? I kind of joke and say that I learned public health backwards on the job while in my prevention role. The prevention role at the DVSA agency was funded by the Rape Prevention and Education grant that I now help coordinate. So that's kind of how I moved from that agency level up to the state. But before that, my degree, like my bachelor's, is in communication with a minor in international security studies. My grad school work is in international relations. And so none of that kind of is a direct connection, although there's a lot of overlap. And I think some of those skills, especially communication skills, are helpful in kind of crafting the things that, we work on a daily basis. But just to kind of make you hopefully feel like, oh yeah, there's room for me here too. My work has included sports marketing, community relations, education things. I managed a doggy daycare. So that jump, not an expected thing, but also there's some valuable connections there. And just some other things that are just kind of, I guess, general. And then volunteer focuses around like animal welfare, reproductive justice, and domestic and sexual violence. I did a leadership fellowship in 2020 through New Leaders Council. And then I guess lived experience. So my own experience with sexual assault and experiences of friends who I've made along the way that have experienced gender-based violence have kind of helped me learn more and bring that perspective into the work and try to, branch out and see what are the different ways that we can work to make our world safer and healthier and more equitable. As far as project highlights go, my two main projects are RPE and the brain injury work. And so for RPE, we are working on, we have 3 focus areas. It's a CDC grant. And so the areas that they gave us this most recent round of funding are strengthening economic supports, creating protective environments, and promoting social norms that strengthen against violence, primarily at the community and societal level. And there are a ton of really cool things. that you can do. But we were also kind of like, well, let's take a step back. What kinds of things should we be funding? What things work? What's effective? And thanks to being in safe states in our partner in sexual violence SIG, I learned that Heidi in Idaho, they had done listening sessions with community members. And it's kind of like, oh, well, obviously, we say that we should center community people with lived experience in things. And what better way to do that than to ask them what would be beneficial to them? So I'm excited that we are getting ready to contract with local, like community-based organizations in order for them to help facilitate those that information gathering, so we can make sure that what we are offering at the state level is applicable to them. And so it's not quite research to practice, but I think it rhymes, right? And then our partner-inflicted brain injury work, that in that program, we work to bring training, tools, and technical assistance to promote brain injury aware, trauma-informed care for victim survivors of domestic violence. And we work with Ohio Domestic Violence Network as our training and TA partner on that. And they are the ones who do the research to practice piece with the Ohio State University. And so they did research to kind of determine what is the prevalence of survivors experiencing kind of head trauma and, potential brain injuries. And they found that, the survivors that were engaged in services, over 86% of them had been hit or hurt in the head, and 83% had experienced strangulation. And so that told us that this is a really big problem. We told them that it's a really big problem, and we need to make sure that the people who are working with survivors are equipped with the tools to best do that, to ensure that they have access to healthcare that's appropriate in the immediate and long term, to help promote bodily autonomy, so people know, why, what's going on with my body, kind of give them a sense of ownership back after that's been taken away from them, and help them kind of learn why things might be going on. You're not crazy. You're not stupid. There's an actual injury, even though we can't maybe see it, and learn how to best accommodate people within services. So instead of asking every survivor to kind of fit in a box, we can and should modify our programming and our offering in order to make sure that they are able to stay safe, engaged, and supported. And so those are the two things that I think are kind of exciting that we are kind of doing in our program role. And some other things, I guess, one of my personal side goals is helping to build relationships between our county health departments and health department services and the agencies that are supporting victim survivors of violence, so that we can do warm handoffs. And also there's some cool conferences coming up. So the National Symposium on the Sexual Behavior of Youth is coming up in Oklahoma in February, I believe. So you should come. As far as mentorship goes, I think for me, it's been largely informal, kind of similar to what Jess shared. And I think that kind of what has been really helpful for me is just interacting with a wide variety of people. You don't necessarily need to pick them for a specific reason, but also I think that it's helpful to just chat with people, learn about what is interesting to them, and also, you can get engaged with people who have skills that you might admire, even if they're not in a positional leadership kind of arrangement, and just have chats about what you're curious about. And you can learn from people who are, they might have more work experience, they might have less. It might be another student. It could be somebody who's been around for decades and working. So I think that's kind of that approach to things has been really helpful for me, as well as a peer-to-peer approach. I know that I enjoy talking with other people who are kind of doing similar work and might have similar experiences, or their experience could be really different and their perspective is one that I might not have. And so it's something that is helpful for me to be able to implement. Getting involved in things that you're interested in, finding your niche, and or carving out your spot, asking help when you need it. And then one thing that I think a lot of students, early career professionals, and people who are just kind of still going is that it can sometimes feel intimidating when you don't think that you have all of the experience that's necessary for something, but you're here for a reason. You can always ask for help. And I think getting involved in the different committees, kind of You've shared that this student and early career professional group has and offers, and then some of the other work groups and SIGs that Safe States offers, is that it lets you build some of those skills that you might be looking to build in a supportive environment and kind of get connected to people from all over the country. And I know that Hannah mentioned the conference earlier, but I did want to do a special plug to invite y'all to get engaged. Thanks to being involved with the things, I am now the chair of the annual conference planning committee for 2025. So I hope to see all of you in Atlanta in September. And I wanted to invite y'all to kind of get involved in a variety of different ways. We have a planning committee that meets the third Thursday of the month. If you want more info, feel welcome to email me. Submit an abstract if you have something that's really cool and you'd like to share with everybody. The submission window is January to February. If you want to sign up to review abstracts, that's a good way to like dip your toe in, and then you can volunteer on site. And here's my contact info in case anybody is interested or has questions. And those are our websites as well.
Brilliant. Thank you so much, Emily. I appreciate the plug for the Safe States Conference, as well as the tangible examples about how being part of the Safe States community and your involvement in different committees has been a catalyst for your continued growth and professional development. I also want to nod at one of the things that you raised, because I expect it's true for many folks in our community. We find ourselves getting involved in injury and violence after unfortunately having kind of a personal sense of why these things are so important to prevent, right? Experiencing things ourselves, having someone close to us go through an experience, seeing community members have or go through preventable harm, all ignites a passion that's worth following. So thank you for sharing that part of your story. So we have a handful of minutes to have additional questions. I also want to be sure that folks have access to the evaluation page that's QR linked here. Understanding what's helpful to you all is very important to us. So any feedback here that you're able to offer as we wind down today, we're very grateful for. And because we have I think a small but mighty synchronous crew with us, feel free to kind of unmute and ask any pressing questions, or if the chat is more convenient or more comfortable, that is also welcome. So I guess while folks are warming up, I might invite, because I know mentorship from community partners has been, I think, kind of a cross-cutting theme from today's talks. So if I could ask our speakers to reflect on if there's a tidbit, a bite of wisdom that a community mentor shared with you that you feel would be helpful to pass on to our attendees, if you would go ahead and volunteer that would be awesome.
I can go first. One of my first kind of unofficial mentors, the phrase that always goes through my mind whenever I think of her is choose what hill to die on. Because her point was to be very strategic in terms of what battles you fight and how you conserve your energy and what will make the most impact in the long run. Because when you're doing work, especially work around health equity, there are a lot of fights that you can expend your energy on, and not all of them are worthwhile. And all of them will drain your energy. And so that is a phrase that I think of at least weekly. Like, choose your battles, not that many battles, put some battles back. We can be a little bit more strategic about this.
Very well said. Thank you, Jess. Do others have thoughts they'd like to add or tidbits of wisdom to share?
I think one that's been a little bit helpful for me is you should do it. And so I think in some of the things, sometimes I know like Shelly from Safe States, I'll reach out and be like, oh, well, what do you think about this? Or could you tell me more about this? And her reply is just, you should do it. Like you should try. And so I'm trying to like channel that a little bit more. And so I think that is super helpful to sometimes have some outside encouragement from another person. And so, you know, when you ask for advice, it's always nice that little tidbit is popping.
I think one that's resonated with me is to celebrate the little victories, because sometimes depending on what issue, I mean, really across the board, but a lot of work, especially when it's community engaged, like especially with injury and violence prevention, it can, you know, like you care a lot about it, so you're very invested, and it can be difficult. So I think just really always giving yourself time to celebrate for yourself and the people you work with, like the little wins, and being mindful of those as you like continue advocating for, like working towards bigger changes.
I think mine that I always need to be reminded of is take your time and ask for help. You know, years in school altogether, I've never had a gap year. And so for most of my life, I've just been in rigorous academia. And so I'm so used to working independently that at times I have difficulty kind of zoning into my work a little too much, especially like Jessica mentioned, there's so many fights to fight that you just kind of like don't know where to go. Your options are kind of limitless, it feels like. And so all of my mentors, unofficially and officially, have done a great job reminding me of like, in picking your battles, also learn to pick your battles of when do you want to ask for help. And I think that touches on community-based organizations as well, because with my qualitative study, we initially did not recruit with partnerships. We were trying to do it ourselves because of our limited funding and resources for this project. We weren't sure if we were able to compensate community-based organizations appropriately to help us recruit. We were just kind of relying on getting the word out there, and maybe if the snowball starts to roll with some of the first few focus groups, then maybe we'd have more participants. But really, it just was not as successful as when we finally pivoted to community-based partnerships for recruitment, and our numbers per each group kind of doubled. It was it was just an insane amount of work, a lot of engagement from participants, since they were being held at the focus group, at the host sites of the community-based organizations. So the people they brought in felt comfortable there. And so like, and then in and of itself, that all always boils down to me as always ask for help from people who may really have those connections that you're looking for, whether internally or externally, just ask for help.
I love that. Oh, thank you all. I think that's a great way to kind of wind down today's session. So to recap succinctly, remember to choose your battles. Remember that you should do the things that you find passion in. Celebrate the small wins, because we are in a marathon, not a sprint. Right. This will be a lot of people doing a lot of good work to move the needle in a desirable direction. And very important reminder from Fran to ask for help along the way. We exist as a team, we exist in community, and so I hope that you all will think of the Student Early Career Professional SIG as a team that you can look to for help and for support, and for folks who will help you celebrate the small wins that pop up along the way. So I think we're butting up right at the top of the hour. So again, please remember to complete the evaluation. Enormous thanks to our Safe States Alliance team members for organizing, and to our wonderful speakers for their time and their thoughts today. Is there anything else that we need to touch on before we wind down?
I just want to echo what Hannah said. Thank you all so much. Each had like a different perspective and it built off of each other. And it was really cool seeing all of your career paths too. And yeah, thanks so much.
Well put, Emily. Comforting, affirming, helpful content today. So with that, happy Friday all. I think we're in a place to stop the recording and shift to the